As parents and caregivers, we all want only one thing: to keep our children healthy and safe. But are we doing everything we can to catch problems before they start? I'm Dr. Motahare and you are watching the Art of Medicine channel. In this video, we'll explore the most important preventive screenings your child should have from birth through the teenage years. These are simple, science-backed checks that can spot silent issues early, support healthy development, and give your child the strongest foundation for life. Stay with me as we walk through each stage of life, because when it comes to our children's health, knowledge truly is power. In the first 24 to 48 hours of life, babies go through some of the most important health screenings they'll ever have. First is the Hill Prick test, which is also known as newborn blood spot screen. With just a few drops of blood, we can check for dozens of serious conditions, including phenylketonuria, congenital hypothyroidism, and sickle cell disease. These are conditions that can be treated early. Next one is the hearing screening, which is a quick, painless test. Helps identify babies who may have some kind of hearing loss, so they can get support as early as possible for speech and language development. Then there is pulse oximetry, a simple oxygen check that can detect certain critical heart defects. Some of these conditions may not have obvious signs right away, so early detection can be life-saving. The other one is screening for jaundice or high bilirubin level. Untreated jaundice can lead to serious complications like brain damage, but with screening, it's easily manageable. And finally, there's a full newborn physical exam, where we check everything from baby's hips and eyes to reflexes and genitalia, making sure the baby is adapting well outside the womb. These early screenings set the stage of a healthy start in the life, and they are one of the most important steps we take in the modern newborn care. After the newborn stage, the next few years are a critical window for a child's growth and development. That's why regular checkups during infancy and early childhood are packed with important screenings. Let's start with vision. Around age 3, children begin formal vision screening to catch early signs of conditions like lazy eye, things that are completely treatable if caught early. Hearing is also re-evaluated in early childhood, especially if there are concerns about speech delay or repeated ear infection. At around 12 months, we typically check for anemia, especially in babies who were premature or not getting enough iron through diet or breastfeeding. Another key screening is for lead exposure, which is important for babies who live in older homes or communities with lead paint or pipes. Lead can affect brain development, so catching it early matters. And perhaps most important during this stage are developmental and behavioral screenings, which are done at 9, 18, and 30 months. These identify conditions like autism spectrum disorder or developmental delays, so that early intervention services can begin when they are most effective. This stage is all about tracking milestones, catching delay early, and ensuring every child has the healthiest foundation possible. As children move into school age years, roughly ages 6 to 12, the focus of screening shifts slightly, but it remains just as important. First, we continue regular vision and hearing screenings. These are often done at school or during annual checkups to catch any issue that could affect learning and development. We also monitor growth and nutrition through regular BMI and height and weight checks. Sudden changes in growth pattern can be early signs of nutritional issues or underlying medical conditions. Immunization are another big part of this stage. This is when we make sure kids are caught up on all required vaccines. In addition, we start introducing psychological and behavioral health screenings, especially if they are concerned about mood, school performance, attention, or behavior. Mental health issues can start to show up in this age group, and early conversations matter. And finally, oral health becomes a key part of preventive care. Pediatricians often check for signs of cavities or refer dentists if needed. This is a time when children are building habits that last a lifetime. So it's the perfect opportunity to reinforce good health, hygiene, and well-being. And finally, adolescence. Adolescence is a crucial time for health screening that support lifelong wellness. Starting at age 12, yearly depression screening helps identify early mental health concerns. For teens who are sexually active, screening for sexually transmitted disease protects reproductive health. Healthcare providers also routinely assess substance use and other mental health risks to encourage healthy decisions. Monitoring body mass index and blood pressure helps catch early signs of obesity or hypertension. Lastly, important immunization like HPV vaccine protect against serious infections in the future. Preventive screening are more than just checkboxes. They are your early warning system. From newborn to older adults, knowing when and what to screen for can change lives. As we've seen, each life stage brings its own unique health needs. So don't wait for symptoms. Stay informed, stay proactive, and talk to your healthcare provider about the screenings that matters for your baby. Thank you for watching The Art of Medicine with Dr. Motahare. If you found this video helpful, please hit the subscribe button and turn on notification to stay updated with more trusted health information. Take care, stay healthy, and see you in the next video.